Good morning and welcome to Frontiers of Knowledge segment of Dr. Lamba's Awakening Call. Every year, every age has its own pet technological development, and Industrial Revolution 4, which is ongoing Industrial Revolution, has nanotechnology as its thrust area. In the last few years, nanotechnology has made tremendous progress, and I still remember when I published my first three articles on nanotechnology in physio.org. There was a spate of comments that this is something which is unimaginable. But nanotechnology has made inroads and a powerful impact in all sectors of life. Take up paper, textiles, food, medicine, arms, and ammunition. Imagination staggers that nanotechnology is making so powerful impact and useful. Mind you, that's a big thing. Economy of resources is there. And the latest developments show that this progress is an ongoing process. For example, could you have imagined even a couple of months back that you will have bandages that will not only heal but also be able to detect and prevent infection? Now, who doesn't need a bandage, right? From a child who scraps his knee to a soldier fighting on the border or a ruffian trying to hoist a sectarian flag on the national monuments. Bandages are great for covering wounds, but if they can be made to detect infection before it onsets, they are extremely useful. And that has been done. A graduate student of University of Rhode Island, and now he's an assistant professor, Dale Roxby and Muhammad Moin. They have created a new type of bandage, and they have done it by embedding nanosensors in the fibers. It's a non-invasive way to detect, monitor an infection, as well as to heal the wound. And according to Professor Roxbury, single-walled carbon nanotubes within the bandage will be able to identify an infection of the wound by detecting concentration of hydrogen peroxide. Now, this was there, but there was no way to determine whether hydrogen peroxide is there or not. But these carbon nanosensors embedded in the fabric shall do it. And then market another thing. Until now, the challenge with using the carbon nanotubes was that they would immobilize the fabric. They were not compatible and they could not stay sensitive to their surroundings. So the microfibers that are now encapsulating the carbon nanotubes accomplish both these tasks. They do not leak from the material, they stay sensitive within the wound. And this bandage can be monitored by a miniature wearable device, which will wirelessly, by optic fiber, detect the signal from the carbon nanotubes. The signal will be transmitted to a smartphone type of device that will alert the patient and the doctor both. That look here, in the next 1 day, you are going to have infection in the wound. So take a preventive action. This is an extremely useful diagnostic device. However, the hope is that the device will diagnose infection much sooner and benefit A, less pain, B, less use of antibiotics, which are very harmful, and preventing drastic measures. Sometimes infection can lead to limb amputation as well. Especially, this is going to be useful for the people who have wounds and are suffering from diabetes, where the management of the chronic wound is a routine. So it will be a routine thing. The people put the bandage on and they will know whether there is likelihood of infection or not. And the children. So this is one of the latest steps. Second, nowadays in the COVID, our biggest problem has been the respiratory diseases, the troubles, whether it's asthma, bronchitis, pulmonary thrombosis, tuberculosis, respiratory diseases are a major problem. And fighting the virus from the respiratory diseases has been difficult for one reason that their detection, rapid detection was never there. People start coughing. They'll have phlegm, but then they could not be detected. So, not only that, the other was that these diseases were spreading much easier because the moment you cough, moment you breathe, the virus travels outside and goes to the other person. And it travels across the globe as we are seeing the coronavirus. So the Young and University and Korean Institute of Material Sciences, they have developed a new 3D nano popcorn. Now don't think that you're going to eat this popcorn. This looks like popcorn. It's a nanomaterial. Is 3D printing is possible. So they use it as substrate and that can identify, detect the respiratory virus much before you emit it through breathing. Wow. So, infectious diseases, as I said earlier, whether it's a flu, SARS, MERS, SARS 2, coronavirus, whatever, they are a global threat. And in this design, what the scientists have done in these two universities in South Korea, they have coated 2 layers of gold particles on a polymer substance. And how they have done it? By using thermal evaporation sequencing. The two coats are separated by a treatment of a compound called PFDT, which is a nano compound. And the energy difference between PFDT and the gold layer causes the gold ions to diffuse to the surface, forming nanoparticles. So automatically, somebody coughs, somebody suffering from diseases come near that, these would assume the shape of uniformly spaced popcorn. And this arrangement collectively would strengthen the signal intensity that is produced by generating multiple hotspots on the substrate. And even before any symptom is there, the doctors can easily, by having you breathe on this substrate, find out whether you are going to have it or not. And Dr. Jabam Chu, who designed it, was telling the other people, and it was reported on last Friday, that the moment you breathe within an area of 10 meters of that substrate, the doctors would find out immediately as the substrate would come in the shape of a popcorn on that particular piece. So they can have this in their office. You go in, you breathe, and doctor will be able to identify right away. Doesn't it look like magic? Yes, it is. But it's a magic which gives you life, hope, sustains you. Then Michigan State University has developed a new method to understand how medicine, nanomedicine, can be used in emerging diagnostics and therapies that are small but intricate and they interact with the patient's molecule. What they do is that the patient's biomolecules are interacted by very intricate process and then the medicine is prescribed by the machine. So this is an arrangement where artificial intelligence, augmented intelligence, and human brain come in close relationship and the patient is diagnosed and treated by the machines using the brain. That's why I said augmented intelligence comes into the picture. And before we close, most of the problems, diseases are known, are there before we take birth. They're genetic. So now the Children's Hospital of Philadelphia, the researchers there, and the University of Pennsylvania School of Engineering and Applied Sciences have come up with excellent nanoparticles that give therapeutic nano ideas before the birth. And they tell us about the genetic defect that the child would have. These ionized lipid nanoparticles are used to deliver a part of fetal therapy. Not only are the defects identified before the birth of a child, but they can be rectified. And the proof of concept study was published just yesterday in Science Advances magazine. And they have engineered and created a number of lipid nanoparticles formulations. And they target the mouse fetal organs, lay the groundwork for potential therapies. And it will treat all the genetic diseases before the birth. So the child would be born healthy and absolutely free from the worry. This is a very important step, especially in identifying non-viral mediated approach for delivering cutting-edge therapy before birth. And according to William Pettigrew, MD, and surgeon at the center, he said that these particles would provide a platform which could be used in therapies, not only for identifying disease and rectifying it, but also for fetal protein replacement and gene editing. So even the genetic editing can be done. The whole behavior can change. This is something absolutely out of the ordinary and shows how human ingenuity capability can go. You see, there have been recent advances in DNA sequencing technology. There have been advances in prenatal diagnostics, but the protein and enzyme replacement therapies used to be after birth, and the result was a damaging effect had already taken place. So, with this new technology, when the baby is in the as a fetus, they will be cured. The therapies would be applied still in the womb, and the child would be healthy. The small fetal size allows for maximal therapy dosing. An immature fetal immune system is more tolerant of replacement therapy. Once the child is out of the womb, its immunity decreases. Inside the womb, its immunity is much more. So, as we see, These nanotechnological developments open a new vista in the treatment of diseases, in the detection of the diseases, and makes healthcare easier, cheaper, economical, and more useful, and there are no side effects. That's the biggest thing. So, not only the medication minimized, but the last one where the gene editing can be done is extremely important from the social point of view as well. Where the people the behavior can be changed and it can be, but then there's a negative aspect. If a dictator comes, he can change the behavior to suit his own ends and purposes. But that's a part of the game. You give some, you take some. But these advances are really, really a miracle of human ingenuity, and it enhances our perception of knowledge. Don't you think so? Meet you next week again at the same time. Thank you.